Okay, so good evening, everyone, and welcome to another Seaside Chat with the Salve Admit Guy. If you haven't met me, I am the Salve Admit Guy, Jim Fowler, Vice President for Enrollment Management. Also, you can find me at Salve Admit Guy on Twitter and Instagram. And this evening is going to be a really exciting opportunity for admitted nursing students to learn a little bit more about Salve's nursing program from the true experts. Some of our graduates who went through the program and are now working in nursing at various hospitals around the Northeast. They've volunteered their time to join us this evening and tell their Salve story. Throughout the presentation, if you have questions, you can feel free to utilize the chat box, or if you want to use a little hand raise feature, and if you prefer to actually verbalize your question through the Zoom platform, we will be happy to answer your questions this evening. Ultimately, the goal of tonight is to allow you to learn what you need to know to choose Salve, because that May 1 enrollment deposit deadline is coming up in just a few days. And I know people are trying to decide where's going to be the right place for you. And certainly we believe that there's no better program out there for nursing than Salve. So to get started, I'm going to ask folks to introduce themselves and tell you a little bit about their Salve story, you know, where they're from, how they found Salve, a little bit about their Salve experience and what they're doing now. And because I know she's old hat at this, I'm going to ask Jenna to go first. Hi, Jenna, how are you? Whoop, you're on mute. I'm gonna get shirts.
I was actually saying, hi guys, can everyone hear me okay? So, my name's Jenna. I'm a 2019 grad, originally from Worcester, Massachusetts. I found Salve my junior year at one of my college fairs that we had. I went through the program all straight 4 years. I had a great time. I was really involved. I was a community service advocate. I ran a mentoring program for the nursing organization. I just did all sorts of little things throughout my experience. I had many local clinicals. Now that I'm a working nurse, I do work at Newport Hospital, which is right down the road from Salve. And when I'm not there, I work at Thunder Miss Health Center, which is like outpatient. So, I am still doing a lot of things, but, you know.
Great, thanks, Jenna. And Robin, how are you this evening?
Hey everyone, I'm good, thank you, Jim. So I found Salve a little strangely. I was online at a college fair and I was actually waiting online to talk to the Scranton representative. And the line was like down the down the hallway or something. And my dad got impatient and he like walked over to the Salve booth. We didn't know it was Salve at the time, and they had like an iPad with these beautiful pictures of like classes and nursing like labs and stuff. And he's like, Robin, get off of this line and come check out this college. And like, then the rest is history. I fell in love. You couldn't talk me out of it. I was going to Salve no matter what anyone said. When I was in Salve, I was a cheerleader. I worked as a student ambassador. I was a peer mentor, so I helped welcome in the freshman students. I did that all 3 years because I started as a sophomore. And I did clinicals all throughout Newport, which and the state of Rhode Island, which I really attribute to helping me get my job now. I work as a pediatric emergency room nurse at Hackensack Hospital in New Jersey. And yeah, life's been pretty good since I graduated.
Great, thanks, Robin. And Jay, how are you?
Doing good, trying to find the unmute button. Hi everybody, I'm Jay Brennan. I'm from North Haven, Connecticut originally. I found Salve. I was looking for small colleges in the area where I felt like I would be more than just a number. And I was looking at all the ones along the shoreline, and Salve stuck out to me. Once I was on campus, fell in love with it, and the rest is history. While I was there, I did a little bit of everything. I ran track and cross country. I was part of the student government. I was also part of the service group in the church. And I got really involved in the nursing stuff too. I was one of the nursing mentors, I believe Robin chair. I might be off a year or two. Um, and was able to do a lot through Salve Nursing. And now I work at Yale New Haven Hospital doing organ transplant. Sounds fancier than what it is.
Great, thanks, Jay. Well, it's so nice of all of you to join us because I know you all have had busy schedules and I know that you have had challenging years with sort of being asked to do a lot of different things. I know one of the big challenges for healthcare for the last 12 months has been that not everybody has necessarily been working consistently in the place where they thought they were going to be working because hospitals have had to pivot and move and shift responsibilities. And maybe we'll talk a little bit more about that later. But right now, what I want to know from each of you is, can you talk a little bit about your experience with the Salve nursing curriculum and what was it about the Salve nursing curriculum that you really appreciated, and how was the classroom experience like for you? Did you feel as though, one, that you were prepared for the rigor of the work, and two, what was the overall environment like? You know, was it manageable? Was it enjoyable? And did you feel like you received the educational experience that you expected when you chose Salve?
Do you want me to go first?
Sure.
Okay. So, like I said, I just recently graduated about 2 years ago, and I'm not sure if anybody in the group is from Rhode Island or nearby, but my first new grad job was over at Rhode Island Hospital. And in bigger hospitals in the summer, it tends to be that quite a few new grads start at the same time. And I was finding that throughout my orientation, I was pretty significantly more prepared on the floor than my colleagues. Not saying that not everybody can be caught up to speed, but I did definitely feel more prepared. I feel like I had more of the nursing theory behind the actions we were doing. And a lot of that I attribute to, one, Salve's class sizes are tiny. You have maybe 20 people in your class with you. I think the cap is like 23. So, and not all of those classes are full. Some of your classes take place right in a sim lab, which really brings it to life. You do your clinicals just like any other nursing school, but then you take it back and you do simulation in these labs that we have on campus, which are fairly new. And it really helps just tie everything together and get you ready. You know, class sizes are small, your professors know who you are. Jay talked about that. You're the opposite of just a number. You know, your teachers probably know more about you than they should, but it really helps you succeed. You know, you're in nursing school to be a nurse, and that's really what they prepare you to do.
Yeah, to piggyback off of Jenna, the class, so I went into nursing school knowing that, you know, classes are going to be slightly harder because you literally have 4 years to learn how to take care of a person and really understand what's going on with that person. And yeah, you have the doctors, but it's your responsibility at the end of the day to make sure that you're advocating and caring for your patient correctly. And classes were challenging, but the thing that always helped me was the fact that at the end of class or at the end of the day, every nursing professor that you had, their door was open and you could go spend 5 minutes or an hour and 5 minutes in their room or in their office because they wanted to help you and wanted to make sure that you succeeded and you were doing well. No one fell behind because they wouldn't let you. If you didn't feel like going to class that day, the chairwoman would like call you and be like, where are you and why aren't you in class? Like that's how well, and that's the chair of a department. Like that's how well this school knew their students. And I really appreciated that.
Two tough acts to follow. I think Salve prepared me for the NCLEX 10 out of 10. And for the practical portion, 9.5 out of 10. There's always gonna be a little bit of learning on the job. It's just the way it is. But I think both these two guys, both Jenna and Robin captured it, that, you know, everyone really cares about you, that you know your classmates, you know your professors, and can't ask for too much more than that.
I want to kind of go back to something that Jenna said, because I hear this a lot from Salve nursing grads, that when they get out of the program and they get particularly into that first job, that I think everybody thinks, okay, everybody graduates and they go to their first job and everybody's sort of on the same playing field. But in actuality, the transition that happens from undergraduate to that first experience, there's an onboarding process. And that onboarding process is modular. So in many, particularly hospital settings, the hospital recognizes that not everybody that they hire is necessarily going to be a rock star. And so the onboarding programs are typically designed so that, somebody might get through it in 6 weeks, whereas another person, it might take 12 weeks, whereas another person, it might take 18 to 20 weeks. And I hear constantly from Salve grads that they're the ones that get through it in sort of the accelerated time, whereas graduates of other programs maybe have to do a little bit more remediation or a little bit more onboarding because they're not quite as ready for that clinical experience. Would you all agree with that assessment? I mean, I hear it a lot, but I want to know if that's an accurate observation that is universal.
I absolutely agree with you, Jim. I was a new graduate. I started in a pediatric emergency room, which is pretty unheard of. You don't start in an emergency room. You need way more you need years of critical thinking and clinical experience. But Salve came with a reputation that they produce great nurses with already starting with their critical thinking skills. And I was actually pulled off of orientation early because they were like, oh, this girl gets what she's doing. And I accredit that 100% to Salve preparing me for the real nursing world.
If I may jump in, I agree with you. We have an onboarding process at Yale that takes about 2 months. After completing that onboarding process, I was teaching people the next day. Which was an awesome experience. And I still do it. Probably I get a new resident every 3 or 4 months at my position. And I love teaching, but I feel Salve really set the groundwork for that.
And I think, the other question that I often hear from particularly prospective students before they get to Salve is, okay, the nursing program is going to be demanding. It's going to be rigorous. There's going to be a lot of science. So there's going to be a lot of lab time. There's going to be a lot of study. Will I be able to have a life? Will I be able to participate in activities? Or is it just going to be sort of all nursing all the time? And I'm wondering if you could each sort of share your experience at Salve. Did you feel like you had an opportunity to enjoy college and actually have an experience and meet people and develop friendships and all those things that you want in your college experience alongside this really strong and rigorous clinical training?
So shortly, yes. So what's great about Salve, not only will you have time to do things that you want to do, of course, over the time of nursing school, you really learn how to manage your time and make the most of your studying and figure out what works best for you. But there are tons of extracurriculars that you can get involved with that both include nursing and are totally different than nursing. So a lot of the sports, you can do like all sorts of fun leagues or things like that. You can do different clubs, whether they're related to nursing or not. You can do community service. You can still go out. You can't go out as much as maybe some of your friends in other majors, but you can still go out. And for friendships, the same thing goes for that. I'm sitting with a current Salve student who's my friend. She's like right here. I'm going to show you. We just got sushi and we're still, she's studying now because she's a senior. But, you will still have life outside of Salve nursing and still be part of the Salve community as long as you can manage your time, which you have to learn how to do that to be a nurse anyway. So.
You 100% can do anything and everything that you want. You will study, that's part of college. And then they encourage you to do other activities, because if you're only focused on nursing, that's not how you become a good nurse. Like, they really focused on becoming a holistic nurse and knowing every aspect of a patient. And you're not just going to do that through like okay, this is the heart and this is what the heart does. Like, no, what are exercises that help with the heart? What do you do to help like promote healthy hearts and stuff like that? So they want their students to be involved in other activities.
Yeah, I felt Salve really did a great job at easing me in from high school to college doing that transition. Um, that first year, they really taught me good time management, and I was able to, run for student government, participate in a varsity sport, and do silly things like be the school mascot for my freshman and sophomore year, along with a whole bunch of other activities and service trips. Time management is key. There's a time for work and a time to relax and have fun, and everyone will find that balance some way, some shape, somehow.
I want to latch on to something that Robin said, because Robin, you were talking about the humanistic aspect of nursing, and really, every prospective student I've ever talked to about why do they want to become a nurse, at the end of the day, they want to become a nurse because they want to help people. They want to be part of the healthcare system, but they want to have that sort of regular patient care aspect to it that not all specialties and not all medical pathways necessarily provide the way that nursing does. And when we talk about Salve a lot, we tend to talk about the mission, and we talk about the 5 critical concerns of the Sisters of Mercy, and we talk about the importance of the core curriculum providing sort of that broad-based experience so that you understand culture and you understand religions and you understand philosophy, as well as your strong clinical and scientific experience. And I'm wondering if any of you can sort of expound on that, of how that type of educational, that sort of comprehensive educational experience that's not exclusively clinical training, not exclusively nursing training, helped maybe make you better prepared for nursing and better prepared to be a strong patient advocate.
So I have a perfect example. I'm Jewish and I went to a Catholic college. And prior to Salve, I had an idea of other religions, but part of that core curriculum, we were required to take a couple religion courses. And I took a course with Sister Marta in Jesus and the Gospels. And I learned so much about not just like the Catholic or the Christian religion, but so many other religions and aspects of them that I take into my clinical nursing today. In an emergency room, it's a melting pot. You get everyone and everything, and you have to be aware of culture diversity is in different religions and how to take care of different religions, because some people will not make eye contact with you, and in some religions, or in the American, not religion, but in the American culture, that's considered a little rude to not make eye contact, but that's very common in other religions, that making eye contact is actually rude. So I learned part of these things because I was required to take courses that prior to being at Salve, I had never known because I was raised Jewish.
Going off of that too, noting the fact that pretty much everybody in the Zoom room either is or wants to be a nurse. And when you're a nurse, you are a case manager, you're a social worker, your eyes and ears for the doctor. You're a little bit of everything, and not every social issue goes straight to the social worker. You do a lot of middleman between, especially on like med surg units, especially if you want to go into OB, which I know is a popular track that future nurses want to go into. And just to have that holistic view of just everybody being all different backgrounds and things like that really, really helps, which is something that Salve's mission really implements just throughout your entire education, both in and out of religion classes, even in the core classes.
Jumping off of what Jenna said, I'm also sometimes the electrician and the fireman. That I really do, Salve kind of took me out of my comfort zone and helped me see things from another person's perspective, which I thought was very, very good. What kind of makes that person, what's that their wants, and what are they expecting out of this hospital admission? Why are they here? Sometimes there's another reason why they're here, social reasons outside of that. And it's not just sometimes the patient, but it's the patient's family in a lot of cases. But Salve has kind of taught me to be more open-minded and more looking at the big picture.
Now, we've referenced the pandemic a little bit earlier, and the sort of the unexpected that came with the pandemic for you, and for everybody in healthcare this year. And it's not unusual that, people that were on one floor were asked to go, do a med surg floor, or do a COVID floor, or cover some other department that was not their specialty. Can you talk a little bit about if any of you had that experience? And if so, did you feel prepared to pivot? And what was it about your education that allowed you to do that? Did you feel like you got either through clinical experiences or classroom experiences, just that general adaptiveness, that resilience that would allow you to pivot in this really unusual situation?
So, back when I first started as a new grad nurse, and as I was getting my first job, I worked in something called hematology oncology, which is blood and blood cancers. So I did that over at Rhode Island Hospital. And in the beginning of the pandemic, we were told we won't see a single COVID patient ever up here. We're a nice, clean unit, and it's inevitable our immune compromised cancer patients can get COVID too. And aside from that, after being moved to other floors and things like that, I voluntarily was on the COVID unit for the majority of the first wave, just so that we weren't having as much cross contamination between clean staff and COVID staff. So, if there's one thing I knew from Salve, it was prioritizing patients and being able to deal with situations that you might not have seen before, but you can kind of draw what you have had, and maybe simulation or clinicals. To bring it down to basics, just basic triaging. Is the patient breathing okay, and things like that. What I also do as well is when I work at Thundermist, I work in the respiratory clinic, which manages community outreach with COVID testing. We do the monoclonal antibody treatments and things like that. So I've drawn off of talking to people who are sick, and talking to people on the phone who just found out that 3 out of the 4 people in their house just were diagnosed with COVID, and nobody gets to leave the house to go get groceries for at least 10 to 20 days. So, and just being able to talk to people is something that I feel like I developed at Salve as well, just with different, practice interviews, talking to fake patients and things like that. It's really hard to break that kind of news to people. So just all things that Salve was able to help with.
So my department is strictly pediatrics. We see kids from the day after they're born. They get discharged from the hospital, and then the parents come back because of something, whatever. There's lots of reasons they bring their babies back to the hospital, and then we see up to age 22. So during the pandemic, people started to get worried about bringing their children to a hospital full of patients who have COVID. Completely understandable. So we saw our population drop to nothing. I can recall a couple nights where I was working overnight and I would color, and I'd be like, this feels weird. I should not be coloring right now, but they're paying me to stay here and wait for a pediatric patient. I'll color. Well, that quickly ended, and they turned our unit into overflow from the adult ER. So I went from never being a nurse, I was a nursing student, to a pediatric emergency room, only taking care of patients up to age 22, to coming into work one day and being told, you're going to take care of adults now. So I had a 12-day-old in one room, I had a 98-year-old in the other room, and a 72-year-old. And all of them were complete care patients, meaning that I had to feed them, bathe them, change their diapers. But Salve helped me adapt, because I really feel like my clinical experience, even though I had been almost a year and a half out of Salve when the pandemic hit, I still did so much during my clinicals, and so many different things during clinical, that I could recall upon those times and adapt to this new situation. So for example, my capstone, which is something you do in your senior year, I worked in an adult ER. And I shadowed a nurse for, I believe it was 140 hours, but I loved it so much. I was there for 190. Don't tell anyone. I just stayed. They couldn't kick me out. I just stayed. So I took care of adults, but then I was also on a med surg floor where I learned the basics of med surg. And then I was in a school shadowing a school nurse. So I got to learn healthy versus sick kids, and those kids are healthy, but then being in a hospital, those kids were sick. So I felt like the clinical experiences that I had in Salve helped me adapt to this brand new work experience that I was like totally not prepared for, but we got through it as a unit.
Sorry, still trying to find the unmute button rather. So yeah, I think Robin hit the nail on the head that the clinical experiences at Salve really prepare you for the workforce. When COVID hit my unit with organ transplant, we stopped. No transplants, no nothing. And that was a shock for our patient population. But then half our nurses got moved to COVID units. So for the first wave, I was on a COVID unit for a couple weeks, which was a change in scenery, but you get used to it. And I think the big thing with Salve is they teach you to adapt. You kind of got to go full bore in one direction, something else is happening, stop, address the next problem. And that prioritization is key.
Now, one of the challenges related to the pandemic has been that a lot of students haven't necessarily been able to visit campus this year, or if they have visited campus, they haven't necessarily been able to get into the buildings. And thankfully, you guys are all relatively recent graduates, so you all had access to the brand new labs. Can you talk a little bit about the labs and how you found them to be in terms of providing you a really strong theoretical educational experience, but also some of the kind of fancy, technical things that are available that really, differentiate Salve's program from maybe some other programs that don't have as fancy equipment as we have?
So just some basics of the curriculum, which I'm sure you've heard from Dr. Cherubini, is when you take each clinical, they have at least one simulation day. And of course, the further you get along, the closer to one simulation day you have per clinical. So, you do like a maternity and pediatrics day, you do an acute care day, you do a critical care day. And I will tell you that those days were some of the most valuable simulation lessons that I could imagine having. Because of them, I can read telemetry. I don't think I could even now if it wasn't for the professors that did simulation helping us for 8 hours straight, pretty much. And there's like probably about 12 different mannequins. There's a mannequin that gives birth. There's all different rooms that simulate like a doctor's office even. And it just feels very real. And when it feels real, it's easier to focus and it's easier to retain information. When you're doing different simulations, such as especially with the birthing, you're all video recorded. So you all watch back as a group and see what each person did during a scenario, and you can kind of go off of that. And it's like a post-game or like a huddle where you can talk about what you did really good, what you maybe could improve on the next time. And it really helps you improve because there's situations you'll see outside of there that you'll need to kind of have an idea what's going on.
So a cool thing about Salve is one of the main nursing classrooms that you like take lectures in is like you're surrounded by hospital beds. You're sitting in the middle in rows, although I don't know, I haven't been there since the pandemic, so maybe it's a little bit more socially distanced instead of rows, maybe it's single desk, I don't know. But the room itself is set up almost like a hospital wing and, curtains that close and stuff. And they have mannequins of all different types. They have arm mannequins, they have like pelvic mannequins. So not only are you going through these like full blown scenarios that Jenna talked about in those clinical days, but then you were focused on small little procedures like putting in a Foley or doing a straight cath or IM injections, or sub-Q injections, meaning you're maybe giving someone insulin. And it sounds like, oh yeah, just give a shot to someone, but you had to actually sit there and they had all the tools for you. And you'd sit there and you draw up like, a milky, like I don't give insulin that much. Sorry to other nurses. I don't know, but like you just draw up the different types of insulin, and you have to practice that. If you don't do it every day, clearly you don't know how to do it. But they had the tools to practice that, and then they had these like little tiny rubber things that you'd practice giving a sub-Q. Pinch it. It's called pinch and inch and stick it in, and that's how you give a sub-Q injection. So they had different tools that you could hone in your nursing skills on. And they were available. If you asked a professor, you can go and practice it with them, or in the lab, because there were lab hours, and then there were like students, I believe, who worked the lab, so you could go practice with them. You could practice as many times as you'd like until you felt comfortable with the skill before you moved on. So that was a big help in transitioning into the real nursing world.
It's funny. The lab was new my senior year, so I got to see the old lab and the new lab. New lab's a million times better. Talking about the mannequins simulations, the first time I had a patient that stopped breathing, which we call code, was an exact replica of a situation I had at Salve. So everyone else, and for a new grad nurse, your eyes are wide open and you're scared. But for me, I was like, this feels awfully familiar. So at least I knew what to do. I felt confident, and we were able to help the person out. But long story short, I think the lab is a great setting for anyone trying to practice their skills, get better. They do have lab instructors. That was my job, part-time job senior year. When I was there, it was Monday through Thursday. I don't think we had them on Friday. And it was, I think, till 9 o'clock, maybe 10. And they're, senior students there who are, working just for the same stuff you're doing. It doesn't matter if you're a freshman or a junior. It's just great having the resources available on hand to help improve your skills and help improve your knowledge.
Well, and I think, that's the perfect example of the medical axiom of medical training: see one, do one, teach one, which is, sort of the backbone of medical education, that, by repetition and understanding and being able to then explain it, you gain a familiarity and a comfortability with some of these complicated procedures that then sticks with you. And, in some ways it's like riding a bike. And, to your point, Jay, you find yourself in that situation a couple of years later, you had like a click. Oh gosh, I've seen this before, and now I know what to do, which is really, really exciting. You guys have referenced, briefly faculty. Can you talk a little bit more about your faculty experience? And, is there anybody that you still reach out to regularly to, seek advice or just check in with? What's that faculty student interaction culture like?
Do you want to go first, Robin? No. Okay. First things first, of course, while you're in nursing school, you hold a very professional relationship with each of your professors, and each relationship you have is different. There are some that you may feel closer to than others. And I will tell you that after graduation, my hospice and end of life professor just got a kitten, and he's really cute on Facebook. But and so you do build lifelong relationships with these professors, because especially if you live in Rhode Island, you plan on moving to Rhode Island after graduation, they're your colleagues. Me and some of my professors work in the same places. We're holding the same position. Sometimes they're my boss. Sometimes they're the nurse practitioner that I respond to. So even in a sense, there's a professor who does clinicals for Salve who also works as a provider on the floors that I frequently work on. So she'll come up in the morning and she'll be my patient's provider. And then after 4 o'clock, she comes up with nursing students, and I have one of her nursing students for the night following me around. So, it is really nice to have this close relationship. Typically, all of the students have the same professor for the same classes because the program is so small, with some exceptions. There may be some classes where one section is taught by one professor, one by the other, which I think makes it really fair. All the students are getting the same material, the same lectures by the same professor, and it makes it really easy to keep things nice and even for everybody. So
I couldn't talk about Salve Nursing without referencing Professor Taylor. She was awesome, hands down my favorite. Sorry, I loved everyone, but she was this person who on day one, when I walked into the Salve Nursing Program, I had this thought in my head that was like, I need to be her friend. I want to be her friend. And of course, it was professional during when I was a student, but she knew my life better than I knew my life. She gave me nursing tips. She helped me get my first job. She wrote a reference for my first job. And then postgraduate, I feel like she's along with myself and other students who graduated. I don't know if I mentioned I graduated in 2018, but I feel like she's also our biggest cheerleader. Like she is rooting us on. She checks in on us, says, how are you doing? How are you holding up and everything? And I have that relationship with other professors as well, but she is one of my favorites, and I hold her very dear to this day.
It's funny you mentioned I was going to talk about Professor Taylor too. She was my advisor. And every time my wife and I, my wife was an alumni, graduated the same year as me in 2017. We go, I try to see all the professors when we go to Salve, but Professor Taylor was a really guiding force for me. And Dr. C also was very good, our chair lady, that even when I was stressed out, she said, okay, you have to do X, Y, Z, do it. All right. But even the external faculty outside the nursing department too were always very helpful as well. Some I still reach out to today every now and then, again, when we're in Newport, try to get up there now. Again, COVID's hard, but nursing faculty, 10 out of 10, they really do care about you.
Well, Jay, you mentioned Newport, and obviously we can't have a conversation about Salve without talking at least a little bit about Newport. You know, as people are thinking about coming to Salve, if they do come to Salve, what's the one Newport thing or one or two Newport things that they absolutely have to do, and why is it so awesome to go to school in Newport?
So you have to drive down Ocean Drive. It's beautiful. Like, you'll thank me later for it. It's just beautiful. It's this long winding road that hits the beaches with some of the most beautiful houses, mansions really, that you'll ever see. And then, I don't know, there's so much good food. Like, you should just plan to eat like breakfast, lunch, and dinner every single day. And I shout out Atlantic Grill. It's a great breakfast joint if you need to go there. But there's the food and then Ocean Drive. Those were two of my favorite things about Salve.
So I was going to say Ocean Drive at sunset. So I guess I would have to think of something different. There's so many different things to do. And I guess if I had to recommend one thing, it's to try something new. So many people who live in like landlocked states come to Salve and try surfing. Just like all different things like that. There's like a boat show weekend. There's tons of different like restaurant weeks, tons of places to go and get ice cream with your friends. If I had to pick one thing, it's once you're 21, you have to go to OB's and have a mudslide, and you'll know what I mean when you are in Newport. Go to OB's, have a mudslide. I promise.
Well, when I was at Salve, we ran everywhere. So Ocean Drive, 10 out of 10. I also like the Norman Bird Sanctuary. I'm very into nature. So just going out in the middle of nowhere and just being surrounded by birds, great for me. Other spots for Adams, I love to fish. So I got out there a couple times, especially towards the end. Once I was done with I think we were using HESIs at the time, standardized testing for graduating nursing school. I went out and I fished for a whole afternoon. But you'll find your spot. That no matter what you have an interest in, you'll find your spot. Whether that's history, nature, Newport has it all.
So we're coming to the end of our time together this evening, and I want to be sensitive to the fact that our alums are either at the end of a long day or, in Jay's case, just getting ready to start a long day. But I want to make sure that we open up to questions. If you have questions, please put them in the chat box, or hit that little hand raise thing, or just unmute and start asking a question. That's fine too. We want to be here for you. And I'll ask just sort of one more probing question of our alumni. If you had to do it again, knowing what you know now about medicine, knowing what you know now about nursing, would you choose Salve again?
110%.
Absolutely. 110% as well.
I'd do it 10 times over.
So the floor is open to any questions that you might have.
Well, I'll speak. My name is Bruce Hodges. I'm Amaya Hodges' dad. I'm actually out here in Massachusetts. I work out here and live in Arizona. This is not specifically for the school itself, but kind of more of like the area and around it. I've been to Ocean Drive, beautiful place. I rent one of those little slingshots and drive it around there sometimes. But transportation-wise, how did you guys feel when you were there from freshman year all the way to senior? What are your recommendations as far as public transportation, having a vehicle while you're in college? What are some of your suggestions on that?
There you go.
Okay. So I actually didn't drive until my junior year of college. I had gotten into a car accident in high school and was terrified. So I was able to get around Newport via public transportation, the ripta. It's the trolley system. And Jim, I don't know, but it was free for Salve students. It's still free now. Okay, cool. So you could hop on the ripta there were like 3 different points on Salve's campus and get to the grocery store. You can get downtown. You could get over to the beginning of Ocean Drive. You could get around quite a bit with no problem. Junior year, my dad did force me to start driving because you did have to provide your own transportation to clinicals. However, for the most part, with the exception of your capstone, although they were really great at working with people who didn't have transportation, we carpooled. So you could, here's some gas money, you can go with someone. So I felt like I didn't truly need a car until my junior year.
Thank you, Robin.
Not only are there 3 stops on campus for this trolley, but the first stop after campus, or maybe like the second, is a Stop and Shop. So there's a grocery store right across the street from the Stop and Shop. There's a CVS. There used to be a Newport Creamery, which is like an ice cream shop, but it's no longer there. Tons of little shops and things like that. So it's really like so easy to get around, even if you don't have your car there.
I should also mention that one of the nice things about the ripta system is it's not just the transportation on the island, it's transportation throughout the entire state. And Rhode Island being the smallest state, at least for now, if DC doesn't become a state, that you can really get around Rhode Island fairly easily too, which is great if you want to fly anywhere. You could take ripta and get to TF Green Airport very easily, or get to North Kingstown and take a train to New York or to Boston. So even though we're on an island and we're sort of on the outskirts of Rhode Island, if there's such a thing, ripta can connect you to other points, and that then you can use to get to other areas very easily. Good question. Is it possible for nursing students to do a study abroad program? Did any of you do a short-term study abroad, Jay?
I didn't, but my roommate my junior year actually did. He did the nursing program at the time, at least, had a deal that where you would take a class and then you would spend your summer off in Ireland. I don't know if they're still doing that. I believe they are. Study abroads were kind of hard. You kind of have to fit them in, but it's definitely doable.
I believe that with study abroads, the issue with doing it during a semester was that there are certain courses at Salve that are only offered in the fall or the spring, but this was like a specific study abroad nursing program specific to the nursing program. So that's what they offered. In terms of studying abroad during the semester, it was a little tricky. I personally did not, but I'm not going to say it's not doable. It just could maybe hold you back a little bit.
Yeah, no, I think both of you touched on the issue is, the demands of the curriculum make it difficult to go during the semester, which is why the university has developed these very specific options, either related to a summer or related to the intersession period between semesters, where students can do a study abroad. One of the popular ones is a 2-week that happens down in El Salvador. That's also a service trip. So so students have an opportunity to do a short-term study abroad, get some service experience, utilize some of that medical Spanish. As a matter of fact, there's a great course that's available to nurses where you can get skills in medical Spanish, which is incredibly useful. I imagine, Robin, you probably experience that often in your hospital setting of sort of having that familiarity with second languages comes in real handy.
Yes, yo hablo español un poquito. I mean, Spanish is like, I mean, just like in Rhode Island, though, you need to know Portuguese, but like, it definitely helped.
Robin, while you're on, question here, was
Sure.
it difficult to manage cheerleading and the nursing program at the same time?
Not at all. I enjoyed it. It was my escape. The coach was really understanding about tests. You know, basically you just had to give, like, if you had something going on that you felt like you needed to give all your attention to nursing for the week, you just had to let them know and be really open about your communication and say, hey, I have an important test, you know, and you just manage your time accordingly. But not at all. I enjoyed my time as a cheerleader, and I enjoyed my time at nursing school.
So we'll give just a couple more moments here if anyone has any other questions. But if people don't know that we are all available after the fact to answer questions, you can just reach out to me through the Salve email or reach out to your admissions counselor if you have additional questions over the next week, or you feel like you need to talk to somebody, and we will work hard to get your question answered or connect you with whomever you need to speak with so you can make an informed decision. But ultimately, you know, I think, at least from my perspective as somebody, and obviously grain of salt because I work for the institution, it's my job, but as somebody that you know, through marriage has some familiarity with healthcare and has been in the hospital setting, I can tell you that the reputation of Salve's nursing program is really unmatched. And it's not just a regional reputation either, it's a national reputation. You can go into almost any hospital or healthcare setting in the country, mention Salve Regina University, and they'll know Salve, and they'll know that Salve has a strong reputation for nursing, has a strong reputation for preparing, as these alums have alluded to, graduates that are ready on day one to hit the ground running. And not every program can really say that. And I think that, you know, for me, it makes my job a lot easier when I talk with prospective students to know that I'm not representing a program that's either, you know, not going to get you your clinical, or not going to get you the right preparation to pass the NCLEX, or you're not going to get a job when you graduate. All of those things, check all of those boxes, Salve will prepare you and you'll be ready to go. So, you know, I would put us up against any program in the country. I think that as these three alumni showcase, we really do an exceptional job of preparing nurses that are ready out to go out, not just be good nurses, but be nursing leaders. And I think that that's incredibly important in today's world. So I want to thank everybody for being here this evening, especially Jay and Robin and Jenna. Thank you all so much for taking time out of your schedules, and thank you for everything you've done over the last year. I can't even begin to imagine some of the challenges that you've had to face, and some of the difficult decisions, and some of the heartbreak that has probably come with the last year. But also, I think you probably all agree, like, now you're prepared for anything. And you know, there's no doubt that you're going to really continue to be great ambassadors for the university. I see here that Amaya has a question.
Yes, I do. I just have a question about like how clinicals work. So am I not going to start clinicals like my freshman year? Like, do you start your sophomore, junior year? Because right now I'm in a nursing program. It's dual enrolled with a community college and my high school. And our first clinical date isn't until May 8th. So I haven't been out in the field, but we've done like simulations in our like lab at school. And I just want to know if like I'm prepared for clinicals, if I've done like one day or two, you know, I'm just a little scared, I guess.
Yeah. And I'm going to ask Jenna to answer this because she's probably the closest to the current curriculum because she has some students, and I know that there have been some changes to the curriculum in terms of front loading clinical in a way that wasn't necessarily the case a couple of years ago. So
yes, so kind of going off what Jim said, I frequently do have students. I will be having a capstone student over the summer. I start school in 4 weeks to get my master's in nursing education, so it's kind of something I hold a little near and dear. So yeah, so the way clinical has worked when we were all students was that you started your clinical junior year first semester. I do believe that you now have a clinical sophomore year second semester, but what we had sophomore year second semester was something called health assessment, and that is still a class that you'll be taking at Salve. And that's basically a long class on how to look at a patient head to toe to figure out what's going on with them. I will say, you know, if you are in this dual enrollment program and starting clinicals, you said May 8th, good luck, and you are more prepared than you need to be by just showing up and being ready with a smile and ready to learn. If I have any advice for you is just to keep calm, keep cool, find a CNA or a nurse that looks friendly and follow them around as best you can if you have free time. And don't be afraid of not being prepared for clinicals because you're never going to feel ready, but you'll get there and you'll feel it. So don't panic, but if you do decide to come to Salve, you will start clinical in about a year or two. You have to get some of your core education requirements out of the way first, because you gradually kind of delve more and more into nursing with each year. They like to get the core stuff out of the way in the beginning to make room for more nursier things towards the end. Does that make sense? Great.
yeah, and just to confirm what Jenna said, that we do now, students do start taking their clinicals in their sophomore year, which is a little bit different than the experience that these three alums have had. And for exactly the reason that Jenna said, there's other things that you have to do, and the timing of clinicals makes it difficult to do it as a freshman because clinical timing is not necessarily your choice. It's, you know, slotting into the times that are available within the hospital so that you have the available preceptors. And, you know, what I think one of the biggest challenges for nurses, and I can't remember if it was Robert or Jenna sort of alluded to the fact that you can't always have the same fun experience as every other student on campus because, you know, sometimes you might have to be up at 4 a.m. to go do clinical, which not every student has to deal with. And that's, you know, that's the dedication of a nursing student, is the willingness during their college years to make that sacrifice, to do what you have to do to get the training that you need so that you know what it's like to not only be in a healthcare setting, not only be in a clinical setting, but to know what it's like to be in a clinical setting, maybe at odd hours. And they do that intentionally because, you know, Jay was talking about like his 7:00 p.m. Like this is the start of his day, not the end of his day. And that's different than most of us are used to. And so you have to learn how to adapt to that different schedule that is going to rotate at times in the clinical setting. And so you have to be ready for it. Any other questions? Okay, well, thank you again, everyone. I really hope that we see you all on campus in September. There's really no better place than Salve, and especially this year, you know, after the challenges of this year, you're not going to find a better place to sort of kick off life again than in Newport on a really incredible campus with lots of wonderful things to see and do, and in a program that is not only going to prepare you really well, but is also going to be your family. And I think that, you know, when you hear from these alumni and you hear about their experiences, you get that sense that you really are part of something bigger in the Salve community. It's not just about getting a strong nursing education. It's about having a really personal connection with your alma mater and knowing that that alma mater will be with you for life. And that's really what I think we all want from our college experience. So thank you all again, and have a wonderful evening. Good night, everybody.
Thank you, Jay. Thank you, Robin, Jim, Jenna. Thank you very much for your time. Have a good one.
Good night.